I'm very proud now to introduce one of our own here at GLFHC, Dr. Joseph Gravel. Dr. Gravel is not only a Chief Medical Officer, he also serves as our Residency Director. Dr. Gravel is also one of 100 physicians here at the Health Center who will benefit from this coding initiative. Joe is going to talk about the impact of this coding initiative and how it will improve the lives of the patients that we serve here at the Health Center. Joe.
Great. Thanks, Bob. Can everybody hear me in the back? If I just not use the microphone? Oh, okay. All right, sorry. All right, so I'm Joe Gravel. I'm the Chief Medical Officer and Residency Program Director here at Greater Lawrence. And before I forget, I really do want to express my very profound and sincere appreciation for NHP partners and the Mass League, all your support of our physicians and by extension our patients. I think I'm here today just to give you a little perspective about the patient perspective and the physician perspective and why I think this program is so helpful to improving the care and the lives of our patients. And I was just thinking about how to do that, and one thought I had was just to give you a little tidbit of an hour of my life last Thursday. And so I'm going to do that, if that's okay with you. So this is 1 hour. I do not speak very good Spanish, number one, which makes it extremely difficult for me, so I do rely on interpreters a lot of the times, but just again keep that in mind in terms of these are my 4 patients in 1 hour on Thursday afternoon. So if you look at what the 4 patients came in for, one was on the schedule shoulder pain, another was ear infection or possible ear infection, the next one was follow-up from the hospital, and the last one was blood pressure follow-up. So those are pretty straightforward things, right? Does a kid have an ear infection? So my first patient was the follow-up blood pressure. So she was there to check her meds, and this is Thursday afternoon, about 2 o'clock, and she said that her husband had passed away that morning. So this is my 15-minute visit, right? So one of the things that is tough about primary care is I'm not just there just to take care of her blood pressure. I'm there to take care of her. And so although the schedule says blood pressure, and when the appointment was scheduled, it was to follow up blood pressure, her blood pressure was elevated that day. But maybe it wasn't because she wasn't taking her medications or what have you. So that was one patient, and just going through the grieving process with her and trying to do some anticipatory guidance about how to deal with that kind of issue. She didn't need a psychiatry referral. She did not need a specialist. She needed somebody just to listen that day. So that was patient number 1. Patient number 2 was my 7-year-old with an ear infection, possible ear infection. So I looked, yes, he did have an ear infection. And, oh, by the way, doctor, he's having a lot of trouble in school. Well, why is he having trouble in school? We've been having a lot of family conflict. So that's patient number 2. So it was not just a simple prescribe amoxicillin and out the door. If I was an ear, nose, and throat doctor, that's his problem. My concern is him as a person and his family as a person. That's what family doctors do. So that's patient number 2. Patient number 3 was follow-up hospitalization. So this is somebody who had been at Lawrence General Hospital, was being here for follow-up, and he had an extremely long list on the order of about 10 issues. About 10 issues. He's on 12 different medications. He wasn't quite sure what medicines he's taking. And so one of the things that came out in the course of the interview was he says, I'm having difficulty walking. So I asked, well, why are you having difficulty walking? And what he said was, I go to adult daycare and someone stole my walker. Okay, so I'm not sure how you code for that one either. But the idea really is there's a lot of things going on in a primary care office. And the last one was a little bit more mundane. He's a patient who's got diabetes, hypertension, has many problems. He's had chronic shoulder pain that I've been dealing with. Trying to get him to physical therapy, he does not have transportation to get to the physical therapist. He can get here but he has trouble getting to where the physical therapist is, who's not on a bus line. So just to give you a perspective that what coding is about is really trying to get doctors to be paid for what they do. But one of the issues is that even coding can't fully capture everything that happens in a primary care office. But this is a tremendous start. It's tremendously important. Our physicians, it's sort of like if you tell people you should lose some weight, everybody knows they should lose some weight. It's a matter of just having the tools and the ability to do that. They all know that they should do it. Physicians know that they should code. They all understand. We've explained to them multiple times, many times, how important it is to make sure that we're getting just even a little higher percentage of reimbursement for all the work that they do every day. And so these kind of initiatives really are one step in the right direction of helping our clinicians getting resources for patients so that I could get that kid a little bit more easily. If I code appropriately and do a better job with that, get that kid maybe some services for family counseling. I could get that patient with shoulder pain, maybe some transportation to his physical therapist. I could maybe get, if needed down the road, some grief counseling for my patients. So that's what really coding is actually about. It's really about making sure that our patients who need a lot of support in community health centers get the support that they deserve and that they need. My hope for the future for all of us is that we develop a health system, and I think it's evolving in a very good way, a very positive way. Our family medicine residency has never had more applicants to our program in the history of the residency. We have over 200 U.S. graduates. We have over 600 total medical school graduates applying for our residency for our 10 positions. Just an hour ago, I was talking to one who's in Philadelphia and Jefferson, and she was relaying her sister's an OBGYN, and so this is somebody who grew up in Fairfax County, Virginia, relatively affluent household, and her sister said, why would you want to go to a community health center? Why would you want to take care of Medicaid patients? They're so difficult. And that's absolutely why we're here, and that's why I really appreciate the Mass League and what they do. And I think things like this initiative, this coding initiative, really does allow us to continue to do God's work. I've made a lot of applications to God for more resources, and I'm glad that NHP and partners is stepping in to take care of that. So that's really, what I really want to do is just express my appreciation for this initiative. I think it really is a step in the right direction, and hopefully they'll just continue to grow the collaboration that we have with each institution. So thanks.